Good afternoon, and welcome to another episode of A Nurse That Needs a Heart. I'm Tadia Smith, and I'm a nurse that needs a heart. So much has been happening since my first recording, so I'm gonna do a quick recap, and then I'll get into everything that's been going on. So in 2022, I was diagnosed with dilated cardiomyopathy with reduced ejection fraction. Um, I've been seeing cardiac specialists for years, for 2 years now, almost 3 years now. And recently, my last doctor's appointment, which was fairly almost a week ago, the doctor told me that they were going to open up the heart transplant Lvad evaluation. A heart transplant is exactly what that is. It's a transplantation of a new heart. And an Lvad, which is a left ventricular assistant device, that is actually like a mechanical heart, as they call it. It helps. We have three things that the Lvad can do. The Lvad can actually give your heart a rest, because some people do rebound after getting an Lvad. An Lvad can be used to bridge to transplantation, so they'll use the Lvad and hopefully it'll help your life tremendously until you can get a transplant. Or they have the Lvad, which is like the last thing that they can do, just to give you a little bit of normalcy of life, and there's really nothing else they could do besides just the Lvad. So I'm making this video because things are starting to move pretty quickly. This afternoon I was called by my transplant coordinator. So my transplant coordinator, she will be the nurse that will help me through my transplantation. She will introduce me to my new cardiologist that's going to be on the transplant team, social work, palliative care. Palliative care, I know it's very scary, but it's just an extra dose of hands, nurses, therapists, just people that's there that can listen, that can help you. Those are extra eyes and ears to look in on your case, just in case you have anything that you have worries about, or anybody that you want to talk to, just extra people on your case, just in case anything were to happen. So they're on your case. Nutritionist, and tons of testing. So they told me that the testing eval takes about 2 to 3 days, and I will be inpatient during those times. So inpatient testing consists of labs, more echocardiograms, which on my last vlog I told you guys, which is an ultrasound of the heart. I'm going to get CT scans of my head and my chest and my abdomen, just to check for to see if there are any blood clots or any aortic aneurysms, which are large blood clots that are in your aorta, which is your main vessel that leads to and from your heart, and my chest cavity and my abdomen, to see that if my heart, my abdomen can take the surgery and the implantation of the Lvad device. I will put descriptions at the end of the vlog and websites that you can look these things up, so you can see exactly what I'm talking about, and the surgeries that go along with the Lvad and preparation for Lvad and transplant. Also, it includes talking to a nutritionist, therapist, and my family support has to be there as well. So this is going to be a big to do, and it's a lot to do within the next couple of days. So I wanted to vlog, because I will be vlogging in the hospital periodically, just to let everybody know the updates, what testing are going to be done, how I'm feeling mentally, spiritually, about what's going on. Today is real hectic. I'm trying to get my house together, trying to get the kids and my husband ready for me not being in the house for a couple of days. So as a mom and a wife, I'm trying to get my house ready, And I know there's questions that everybody wants to ask, so please leave comments, questions, or concerns that you have. I'll be sure to try to answer them within the next couple of days. Just note that I will be busy the next couple of days, so if I do not vlog, if I do not answer your questions in a timely manner, not that I'm not going to answer them, I will be answering, but there is a lot going on. I know there's been a question that my neighbor actually asked, and as I was telling her about what was going on, and she says to me, you don't look sick. And I don't know whether to take that as a compliment or not. No, I may not look sick to everybody else, and I may look like I'm doing pretty okay to everybody, but to myself and to those who know me, they knew that the last 2.5 years I put on 60 pounds of extra weight because I'm not able to do the exercises and move about how I usually move about. I sleep a lot, so that it's really hard for me to vlog as well because most days I'm sleeping. Yesterday was a really bad day to vlog, so that's why I didn't get a chance to do so. Yesterday I slept for about let's say 18 hours, give or take 18 hours. I was up periodically. The kids came and woke me up, asked me how am I doing, how am I feeling. And at one point of the day, I did take my puppy out to the backyard where I'm at right now. He's running around. So today's a little better day. I'm just getting up, and it is 2:30 in the afternoon. I'm finally getting myself together. The mornings are usually really hard after I take my medications. A lot of nausea, a lot of running back and forth to the bathroom because of my diuretic medication that I'm on. I am currently on a new diuretic. It's called furosemide, and it is a doozy. The furosemide is a doozer. I'm running back and forth to the bathroom about every 20-25 minutes for at least 6 to 7 hours in the morning. So it's really no way I can vlog. I try to do as much as I can during that time, but right now the furosemide is starting to wear down, so I'm able to sit down for a little period of time and vlog and talk to you guys. Again, like I said, I'm trying to get my house in order, so it comes with making lists and chore charts. Well, we already have chore charts, but just letting everybody know what the extra chores and extra duties that I'm going to need from them during the time that I am in the hospital. Now, I do not know what is going to happen while I'm in the hospital. My doctor has prepared me, stating that since it is a evaluation, that it usually takes 2 to 3 days. But she also informed me that some of the testing that will be done, such as like a right heart catheterization again, that if they don't like what they see, I could be in there longer, or they could want to speed up the process of the Lvad, since my symptoms have been increasing, especially with the fatigue. And they just want, basically, we just can't call exactly what's going to happen within the next couple of days or next week or so. So again, I'm trying to vlog and trying to get all the information out to you guys as I can. Mentally, I can say that I'm ready, but I'm not ready, if that makes sense. I have been preparing for this for the last 3 years. Ever since I was diagnosed, my head is itching. Ever since I was diagnosed, I've been preparing myself. I have been preparing for this for the last 3 years of my life because, like I said, the doctor's appointments and my good team that I have they've been pretty upfront with me about everything and letting me know what was what and what could happen and what are the outcomes of these things happening. So with that being said, mentally I was prepared, but emotionally, now that it's starting to happen, it's 2 things that's going through my mind. That one, that my disease process has progressed and it hasn't gotten better, which is sad in itself. and that I have to have major surgery. And with major surgery comes, risk. And it's hard on me, Like I said, I'm only 40 years old. I have a lot of life. I still have young children, so that's kind of hard on me. But I have a loving, supportive family, and my children are all rooting for me. I I I have my faith in God, which is never going to go anywhere. I love God, and I love everything that He's done for me. He is the best. He's the most merciful. So, with that faith and with my strong belief system and my family, and knowing that God put me in the hands of these doctors for a reason, it brings a lot of ease to my heart. Again, I just want everybody to know that this platform is really for those who are going through the same thing I'm going through, that don't feel like they have anybody they can talk to, or people that understand. Because I understand, how you go about your day, and you try and you're striving, and everybody thinks, oh, you're not sick, you don't look sick, and oh, you can do it, it's fine, it can't be that bad. And people don't realize how hard it is to get up in the morning when your heart hurts. They don't know how hard it is to get up in the morning and you have, or they even get to bed at night when you have fluid on your chest, when your heart isn't circulating as it should, the fluids in your body. How, I sit up for a long period of time, and I get something that they call dependent edema. So if I'm sitting up for a long period of time, my hands begin to swell, my feet begin to swell. So I have to prop them up. So that's hard on me as well. So, it's hard. Like I said, it's hard for me to be a mom, especially of young kids, when they want to go out and they want to go to the park. And I can't really be in the park for that long, especially on hot days, because I am on a fluid restriction of 64 ounces. So that is per day, per 24 hours. So per 24 hours, I should not go over 64 fluid ounces, which is kind of hard, especially in the warm days. Today it's about 75 degrees out, which is this is our second nice day of the year so far. So I am so tempted to get a water ice, but I'm not going to, because then that means I'll have to take an extra dose of transplant, and then that means I have 6 hours of going to the bathroom, which leads into the nighttime, which is bedtime, and not getting good sleep in and out the bathroom all night is something that I do not want. So I'm definitely not going to do that. I'm going to indulge in some ice chips in a little bit, and I'll call it a day. But for those who are subscribed to my page, like, comment, subscribe, share with others. And again, please post those comments, post those questions, so that I can get back to you, so that I can answer those questions about how I'm feeling and how I'm going. And if you would like to know where I get treatment from, or what kind of treatment I was on before, and what therapies did I try before, and surgeries that I've had, and procedures that I've had, just ask those questions in the comments, or in the comments below. But again, please like, comment, subscribe. This is Tadia. I'm a nurse that needs a heart, and I'm out for the day. Have a great day, guys.